Welcome. This is Doug McCall with the International School Health Network. On behalf of the FRESH Partnership, welcoming you everyone to this very interesting session on systems change and systems approaches in school health promotion. Very pleased to be welcoming our two speakers, Lauren Hurlitz, who is I believe a doctoral student, Lauren, with the London School of Hygiene and Tropical Medicine in the UK, and Scott Rosa, who is Director of Research and Evaluation with Concept Systems. As the description of the session indicated, we're looking at moving the discussion along a continuum towards a systems change approach. So we'll be that's the topic of today, and I'll leave you with a question or a request to comment on the documents that have been circulated as part of this information. The session today, I'm going to have a couple of introductory slides to begin the process, and then Lauren and Scott will make their remarks, and we'll stop for questions. If you see on the lower left-hand side, you'll see a little chat box. You can, as questions or comments come to you during the presentations, please type them in there, and we'll come back to them, and I'll read them out loud for discussion and ask the speakers to respond to them. So welcome everybody, and we'll begin our presentation. Just giving a bit of background here. The FRESH Partnership is a coalition of UN agencies and global organizations such as ours and the Teachers Federations and many others, as well as several donor organizations such as the German Development Agency and others. We get together every couple of months, and we've been working together on a number of initiatives which are displayed on the screen here. You can see that we're the second to last point, looking at systems change and the many aspects of that kind of systems approach. But we've had presentations on a variety of other topics shown there. A little bit of out of order, but the panel presentation on April 23rd was actually the session that started our conversations. That presentation was supposed to be made as a panel presentation to the Comparative Education Conference, CIES, in March in Miami, and that turned out to be a virtual session. But I'd invite you to go to the page shown at the top of the screen, and you'll be able to find the recordings and the slides from all those sessions. And as a person who continues to learn about school health promotion, I recommend them all highly. And these are the various documents and initiatives that are described in those sessions. And again, if you go to that website, you'll be able to find them on that page. Just a bit of introduction to the topic, and many of you, I think, will have faced this challenge. The traditional thinking is in school health promotion, at least from my experience and the experience of many others, is that we define a core components of a multi-component approach, such as health promoting schools or safe schools or community schools. We define what's important in terms of core components, and then we often neglect them. But we use those components as a kind of a framework for gathering up a number of interventions, policies, programs, specific services, changes to the physical and social environment. We use them as organizers to pile on a bunch of interventions going into schools. And although there's some coherence, and they gradually are built up into what we call multiple interventions on a given issue, such as physical activity or sexual health, there isn't that attention paid to developing the core infrastructure of a comprehensive approach. And that's, I think, one of the challenges that's prevented us from doing that is because we're not thinking as systematically as we should. And so we've encouraged, the FRESH Partnership has been working to encourage people to think about systems paradigms, and there are a number of aspects that are part of systems work, and they're listed in that very last paragraph on the page. So that's the challenge that we're talking about today. The good news is that it's not so new. The FRESH framework has had two traditional domains and two traditional documents, really, the core components and then topic-focused programs. When we began to write up the indicators in 2009, which was a long process, it was a volunteer process, it was eventually completed in 2014. last year we agreed to try to develop and update our cross-cutting themes, and that's the documents that one of the documents we're going to be looking at is how we can move towards the systems approach. And those dimensions of that systems approach have been explored in research. And I'm really pleased to be welcoming our two speakers, and the work that I identified in my looking around, which brought me to ask Lauren and Scott to join us, is those two references there. So really pleased to be welcoming, I think one of the two of the exciting people that have been doing this work and can offer a lot of guidance to us. And Lauren, if you wanted to begin your remarks and just tell me when you want to move the slides.
Okay, thank you. That's really great, Doug. I love to be introduced to someone who's very exciting. It's always a good start. So yeah, Doug's right. I have just finished my doctoral thesis on the sustainability of school interventions to improve students' health, well-being and behaviour. So I'm going to try and cover a lot in a short time, and I'm just wait for your questions to see if the main areas, I guess, that you're interested in. If you move the slide along once more, Doug, please. So as well as the systematic review, which we completed last year, which was looking at the empirical evidence on the sustainability of public health interventions in schools, I've also finished carrying out a case study of one English school health intervention to reduce bullying and aggression in schools. And I looked at 5 secondary schools over 2 years after the end of an effectiveness trial, which was found to be successful. The actual effectiveness of the intervention in terms of scientific terms, the intervention works, but then I was interested in whether or not it was sustained in those schools over time. And that was quite complementary to the systematic review. So I'm going to present a few of those findings as well today. If you could move it along again, Doug, thank you. So just to give you an overview of the systematic review and then go straight into some findings. So the criteria for inclusion in the review is empirical studies where the fieldwork had at least in part been carried out after the initial funds had ended. So definitely not focusing on intention to sustain, but actual sustainability. Looking at high income countries only, and excluding interventions delivered exclusively by clinical providers. So we weren't looking at co-located interventions in schools that were only provided by a kind of external health service. All of the interventions had to in some way have been delivered by school staff during school time. And the studies that got included, there were 24 studies of 18 interventions in total. I think 7 of those studies were actually of the CATCH intervention, which is a big US intervention focused on kind of physical activity and nutrition. Most of the interventions that were included focused on those areas. I think about 10 of the 18 interventions were focused on healthy eating or physical activity, and then the rest was split on a kind of a range of public health issues, with about half focused on primary schools and half focused on secondary schools. And the main finding in just terms of overall sustainability was that no interventions were entirely sustained, and they all had some components that were continued by some schools or staff. The findings very much mirrored what had been found in Sturman et al.'s systematic review of healthcare interventions. Very similar findings, that kind of partial sustainability is the most kind of common outcome. If you can move this slide along, that would be great, Doug. Okay, and then we synthesized the qualitative findings to look at kind of the facilitators and barriers of sustainability. I'd done this partly because I'd found it very frustrating looking through existing conceptual frameworks, which really list all the factors that might contribute to sustainability, and they're very much a list of things that don't tell you that much about the process of sustainability. So I found that in terms of schools' capacity, and by capacity I mean schools' norms, social roles, and the resources that they have, these are some of the key issues that came up, that educational outcomes took precedence for staff, particularly for interventions that were focused on healthy eating, physical activity, or nutrition, kind of things that wouldn't automatically be linked to the core business of schools, which is attainment at the moment in high income countries. The principal and school administration were hugely important for sustainability, for legitimising the intervention, for allocating resources to it, for being involved in monitoring and evaluating its ongoing delivery. We also found that teachers had a lot of autonomy in terms of just their individual classrooms. So in terms of what they're doing just with their own class, there wasn't much sign of collective action in the school. It was very much down to individual teachers, what they chose to sustain. Funding and material resources like equipment, materials, all those sorts of things were not surprisingly kind of flagged as an issue. And then there was a big thing about how knowledge and information and expertise was continued within the schools, and the detrimental impact of staff turnover, the importance of ongoing training. And then there was also a finding about the potential role of kind of links between schools and social networks in encouraging sustainability. This is really like a fly by your seat of the pants kind of quick run through of the kind of factors that came up. And they're quite similar overall there to healthcare. Staff motivation depended on staff being able to observe and sort of see the effectiveness of the intervention in action. So that wasn't scientific effectiveness, but it was whether it engaged students, whether they thought that they could see it have an impact on their well-being or behaviour, whether it was practically kind of effective for them. Obviously, their confidence in delivering health promotion had an impact on whether they wanted to continue to deliver it and whether they believed it was something they should be doing. Parent support for the intervention also helped. There were very mixed findings about the impact of school climate, which is kind of I think that's quite an under researched area. There wasn't any clear findings on the impact of school climate on sustainability. If you could move the slide on, Doug, that would be great. These were typical things that were happening in schools in terms of adaptation and integration. Teachers had to adapt the intervention over time. They had to fit it into the time they had available. They had different cohorts of students who all had different needs. There was always going to be a need to adapt the intervention materials to fit their current group of students, and students as they changed and matured over their time in the school as well. And then obviously over time there would also be a need for up-to-date materials if that was something that the intervention depended on. Integration into school policies and plans could help with those things like legitimising the intervention, allocating a budget to it, putting attention on it in schools. All of that was very important. And then the wider political context had an impact on whether particular interventions were seen as legitimate at the moment in schools. And they also had an impact on shaping wider social norms, which would then kind of increase interest, I suppose, or decrease it in a particular intervention. For example, if there was a focus on the general public's tobacco use, then that could have an important impact on whether an intervention on reducing tobacco use in students could be successful. I'd like to move on now to the next slide, which is just about the case study intervention. Doug, if you're able to move the slide forward, that would be great.
Sorry, I thought I did.
Oh, sorry. No, it's not moving on my screen. Oh, you went backwards, that's why. One more, please. Okay, so the case study that I looked at was a multiple component intervention called Learning Together to reduce bullying in English secondary schools, but it had a range of outcomes that it was looking at. It wasn't just bullying, it was improved psychological well-being, had lots of factors related to things like reduced alcohol use as well that they thought it might have an impact on. If you could move the slide again, that would be great. It was a 3-year effectiveness trial from 2014-15 to 2016-17, and so I was looking at it in its sustainability in the last 2 years. And the intervention had 3 components. It had restorative practice training for staff that was delivered in the first year of the trial, and then asked schools to work out how to implement restorative practice approaches in their schools. And the main way they did this was through staff student action groups, inviting a diverse group of students, particularly asking for students that were disengaged from school and not doing so well behaviourally, to participate in groups with staff to decide on the best way of implementing local actions about restorative practice or anything else that they thought would improve student-staff relationships. And there was also a social emotional learning curriculum. Schools also received a needs assessment at the beginning of every school year that could inform the discussions in the action groups. So things about like students belonging to their school and current levels of behavioural problems or problems with staff. And I followed 5 schools that I selected based on them doing quite different things in terms of the fidelity of the implementation in the trial's 3rd year. So from 2 schools that implemented the intervention very well, 1 school that completely discontinued the intervention in the 3rd year, and then 2 other schools that carried on parts of the intervention but not all in the 3rd year of the trial. If you could move the slide forward, that would be great. So similar to the systematic review, no schools sustained the intervention in its entirety. They did different things with the intervention. The most successfully sustained component was restorative practice, which was loved by all staff that did the in-depth training or were familiar with restorative practice approaches in the schools. So they all sustained it in their individual practice, but it was only sustained in 1 school at school level. The original action groups were discontinued in all schools after the trial, but 2 schools sustained local actions that were decided on by the schools. 3 schools started new staff action groups that focused on school, on sort of students' well-being. They focused on like LGBT and gender equality. They weren't the original action groups. The curriculum was not sustained in any school, and it was the least successful component. It was dropped by, I think it was dropped by 3 schools in the 2nd year, and then basically by all schools more or less by the end of the trial. And these are some of the things that were important. The components experienced effectiveness, very similar to the systematic review. Staff's beliefs in its effectiveness and its practical kind of usefulness, like whether they could practically do it within their kind of time constraints. And it also showed very strongly that systems thinking was extremely important for shared commitment and ability to sustain the intervention. I can give some examples of that. The restorative practice training focused on how staff should individually use restorative practice and use it effectively, but it didn't provide them with any way of telling them how it might be scaled up across the whole school. How could restorative practice feed into school rules and policies? And the developers of the intervention thought that maybe the schools would be best placed to know how to do that, but that didn't turn out to be the case. We can move on to the last couple of slides. Sorry, it's taken longer than I planned to. So these were the main questions, some of the main questions that I came up with for developers and evaluators and people that wanted to scale up intervention. The first was, is there a need to sustain all components? Staff, particularly in the case study, found that the action groups were useful, but they were useful for a time-limited period, and they weren't necessary to sustain. 2, do staff understand the key theoretical principles to inform adaptation? Staff are going to make adaptations, so it's important that they should know how they should do that by being able to adhere to what the theory of change is. 3, do staff perceive components to be effective? I've covered that already. 4, how would you expect the intervention to be sustained in these sorts of circumstances with high staff turnover, which there definitely is in English schools at least, during exam periods with different cohorts of students who have varying needs, if there wasn't any ongoing training in the initial funding for the intervention. And then the last one, which is on the next slide, was the most important one of all, which is what support do schools need to mainstream an intervention? How do you move an intervention from an interested group of individuals to a whole school, a staff school? when you know that there are going to be staff that are resistant to change, you know that communication in schools is complex and kind of intertwined. You know, what do schools need to support them to do this process? The one school that managed to sustain restorative practice at school level employed an external consultancy to help them do it, because the intervention didn't help them in any way to know how to go about that process. So I've focused on some things here: integrating the intervention to school systems and policies, or replace existing kind of interventions, communicate changes, disseminate knowledge, and having a sort of professionally owned knowledge base on evidence-based practices that students can access, that staff can access. So things like staff turnover or new head teachers coming in and implementing what they would like to do doesn't have such a massive effect on kind of the stream of initiatives that come through schools. I think I've said more than enough there to get you started on thinking. Sorry I've taken so long.
No, that's great. It's fine. We're doing well time-wise. Okay, I'm going to ask folks to, if you have questions for Lauren, please type them in the chat box and we'll come back to them. And also I'll make sure that the Lauren's email address is noted in the recording as well. Moving on to Scott, who's Director of Research and Evaluation with Concept Systems and Systems Thinking and Complexity. Scott?
Great. Well, thank you, Doug, and Lauren, thank you for your presentation. I found many of the points that you were making very much linked to the way that I view the work in schools and our thoughts about how to integrate school health promotion into the everyday educational process. In fact, you know, one of the first studies that I did to come to this topic was an evaluation of the coordinated school health model here in the United States in one state as it was implemented in every school district in the state. So we looked at coordinated school health, the 8-component model, in the state of Delaware as it was implemented, and you know, it was difficult to get traction on the idea that we needed to do an evaluation of the model's implementation without talking about academic outcomes. It just was impossible for us to get traction on funding and resources to examine the model without having some direct examination on academic outcomes. And so we decided to do that work at the looking at academic performance at the school level using school level indicators that were available through the Department of Education. And it, you know, in the end, we did the analysis and we discovered that there was so much to control for and so much variability in the way schools determined how they were going to implement the model, how they were going to sustain the model over a longer period of time, that it really became unsatisfying in terms of the research, and really drove me towards asking bigger questions about the challenges that we discovered in that research. And that's a short introduction to how I came to thinking about systems and complexity in these environments, and what that then means for us as practitioners and researchers going forward and thinking about school health promotion. You could advance, Doug. So in moving from kind of a traditional cause and effect research model that I had really been engaged in for some time leading up to this point, you know, I had to think about how to shift from kind of traditional linear thinking to more of a systems thinking. Now, fortunately, in the past decade, we've seen an uptick in the communication, the thought pieces, the efforts to really take a look at systems considerations for health promotion and public health practice. And so there have been a number of solid articles really pushing public health practitioners and researchers to begin thinking about systems and the complexity found therein, and really helped contrast this difference between linear thinking and systems thinking. So instead of thinking about processes and practices as component pieces, simply concerned with the content, in terms of looking at ways to fix problems or identify symptoms, on the systems thinking end, we're concerned with the whole. We're also concerned with the process of how things link together and how things work together. We're also concerned in the systems thinking realm about the underlying dynamics. This foundational shift between parts and whole is critical to moving from a linear thinking process to a systems thinking process. It also helps to move for us to move away from this idea of identifying and assigning blame. There's in a system, there's always enough to identify those problems and attribute blame to one or more factors that are leading to those problems. And when I say assigning blame, I'm not necessarily just talking about blaming people. There are certainly ways to implicate problematic processes and efforts that are instituted by individuals. But in this movement away from assigning blame and identifying those problems, we're also moving away from this idea of looking to control chaos and establish some order. On the other side of that, on the systems thinking side, what we're after really is to identify patterns. We're looking to identify those patterns, not implicating one pattern or one process over another, but really to think about how the patterns move simultaneously and in concert to produce the effect of the whole. And it's really our attention to detail to identify these patterns amid all the chaos, with identifying all that's going on within these moving parts. Often we find in linear thinking that we're only concerned about the content of the communication, what is said in terms of what the system produces. On the systems thinking side, we are concerned about content, but we're more attentive to the interactions and patterns of communication. How does communication move through a system? Who talks to whom in those systems? How does information move throughout excuse me, the structure of that system? And finally, in linear thinking, we assume that organizations are predictable and orderly, but I think we all know that is not true, and we often deal with challenges associated with that assumption. In systems thinking, we very much assume that organizations are unpredictable and in a chaotic environment, and that helps us kind of better attune our senses to these challenges that we often see within systems. So I present this to you not as a way to demean or demote linear thinking. We've all kind of embraced linear thinking and have to in some situations. I present this merely as a way to contrast the way to think about systems and the way that systems thinking can help us view our current situation through a different lens. And certainly, if I mentioned to Doug earlier that as a systems scientist, this time in society right now is ripe for really thinking about our current situation through a systems thinking lens. Next slide, please. So to summarize, when we talk about systems thinking, we're contrasting major ways that we think about describing organizations or describing the processes that occur within organizations. So instead of disconnection, we're thinking about interconnectedness, how things are tied together. Instead of linear processes, we're thinking about circular processes. Instead of silos, and we all know that organizationally silos exist and are prevalent, we're thinking about emergence, how things come together to produce a benefit that's greater than the sum of its individual parts. We are thinking about wholes as opposed to parts. How are the wholes connected together rather than looking at individual parts? In systems thinking, we're moving away from independent analyses of these components to thinking about synthesis. And I'll talk a little bit later about what the implication of moving from specific analyses to more of synthesis, what that means for our tools and our methods that we need to consider. And finally, we're not looking at parts in isolation, but we're looking at relationships that can be at the programmatic level, it can be at the individual level, it can be at the systems level as well. Next slide. So there are and I'm putting this in air quotes, laws of systems behavior, right? So we think about somebody like Peter Senge's laws as he talks about and describes certain characteristics of systems behavior that seem to be predominant in any systems analysis. And it's often interesting, I keep these handy anytime that I'm working on kind of a systems research project, because I inevitably come back to these to help people who I'm engaged with and helping them understand the nature of systems, because I can often refer to these laws, if you will, to help describe kind of some of the features that we see. For example, I'll often talk about a systems behavior, and I'm referring to number 3 here, that the behavior that we're often investigating or inquiring about grows better before it grows worse. And this is kind of a reaction to the system. In fact, sometimes what we see is that we find immediate improvements in behavior, but over time that tends to wax and wane, and it has, in some cases, it has nothing to do with really the target that we're looking at. It has everything to do with its reaction and adaptation of the system to kind of accommodate this behavior. So people were often wondering in longitudinal studies why they saw immediate effects, and over time those effects are diminishing to the point. And so people were often confused about why we're not still seeing some of those immediate impacts that the changes to the system originally brought about. You've heard, it's certainly in the States, we've heard a lot about number 5, the cure can be worse than the disease. It seems to be an axiom that is continuously promoted on the news by politicians, and in some ways they're using it appropriately. In other ways they're not using it in terms of the clearest sense of understanding. But what happens in systems is that often the solution that we come up with has unintended consequences that we often don't look for. In fact, there's an actual term in public health research called policy resistance, which is the effort to design policy with the best intentions in mind to accommodate a particular issue without really understanding what's underneath that change and how that can lead to greater problems. And finally, number 11, just as an example, I often use this quite a bit to help people understand that within a system there is no blame. The system is the system. It behaves in its own way as a collective effort from individuals, from organizations, from groups. So it really doesn't help us at all to go through and try to identify what part of the system is responsible for what's happening. It's the entire system that is responsible. Next slide, please. So if we think about this, what we often look at in terms of a system, I think that a systems iceberg is often the best way to think about this. So at the top of the iceberg, and as often you know, the smallest part of the iceberg is at the top and what can be observed. And often we spend the majority of our time really thinking about events and behaviors. And we ask the question, what is happening now? We take this very specific look in time to describe what we see now, but know full well that underneath of what we see now are these patterns. And that's where we start to see the biggest part of the iceberg, the things that we can't readily observe right on top. And need to ask the question of how do patterns play out over time and space. And deeper down are these structures, paradigms, and conditions. And it forces us to really ask the deeper level questions of what are the drivers and deep structures. What's really underneath all of this that supports what's happening at the surface? And really to ask how all of these are related, how these structures, paradigms, and conditions are related to kind of support what happens at the surface. Next slide, please. So one of the things that I appreciated about Lauren's talk and presentation was really to understand what makes these interventions complex. And I should say that it's not just limited to school health promotion interventions, but health promotion and public health interventions in general. And what makes these things complex is we have these multiple horizontal and vertical partnerships. The complexity of how tall, if you will, or how wide these interventions are in terms of the partnerships and relationships make things a bit more complex in nature. What also makes them more complex is this search for long-term changes, but the need for short-term results. We've all kind of been in these positions where there's a need for an immediate discussion of what's happening, yet we want enduring and lasting change. And so it really challenges our attention to be able to focus on short-term results at the same time thinking about what long-term changes are ahead. Often we are thinking about organizational change within the scope of intervention. So thinking about sustainability, for example, how do parts or components or the system as a whole, how is there durability in that, and to what extent does that require organizational change to accommodate the intervention rather than just seeing the intervention as a one-time effort to improve a situation. In complex interventions, we have multiple stakeholders with different perspectives. I think about, for example, just a typical high school in the United States, but there are lots of stakeholders that come together to really make sure that youth are learning in a way that's consistent with expectations. Anytime that there's an intervention that's integrated into that, bring more stakeholders and more perspectives. There may be different theories of change that are evident across these interventions, and blending those different theories make these interventions quite complex. Another thing is that there are some limitations of procedures required to advance change, and particularly if we start integrating systems thinking and systems science into understanding these procedures, it becomes even more complicated. Complexity can be overwhelming. To begin talking about a system as its own entity and complete with its own behavioral aspects to it, that can really challenge people to not become despaired about solutions to intractable problems at the systems level. And then finally, they're often thought about in the context of multiple and contested causes. If we think about health of students in schools, there's lots of ways that we might conceptualize the causes for poor health or the causes for good health, and what that then means in terms of the relationship to other indicators of success for students. Next slide, please. So the way we often think about where complexity resides, it's the easiest way to conceptualize this is to think about the intersection of agreement about what is complex and the certainty about things that we can talk about. When we're close to agreement, where we all agree about how something exists and why it exists, and we're close to certainty, down at the intersection of those two dimensions, is where we often find ourselves thinking very simply about plan and control type of opportunities. When we move on the agreement axis towards an area where we're far from agreement, so stakeholders have a great deal of disagreement amongst each others, we're talking about socially complicated processes, and it becomes very challenging to kind of get everybody on board about the agreement of the problem, agreement about the solution, agreement about the efforts going forward. So these are very socially complicated aspects as we're trying to move through that. As we move from close to certainty to far from certainty, those things that remain completely uncertain to us about cause, about the problem itself, and about solutions, we enter an area where things become technically complicated, that it requires solutions that are quite complex. Outside of those two boundaries is the zone of complexity, those where we have to balance these socially complicated aspects for systems change with these technically complicated aspects for systems change. And so complexity is this area where there's a great need to balance both of those. And as Lauren pointed out, sometimes that takes outside resources to come in and help systems kind of think about managing within the zone of complexity, because it's very difficult to kind of understand that what's happening in that zone of complexity while you're in the middle of that systems change itself. Next slide. So there have been 4 systems considerations that have been identified in health promotion and public health practice, and they're very much integrated across these systems domains, and I like this model because it really helps me organize a lot of what's going on in systems. And so we think about networks, knowledge, organization, and models, and these domains have come up in several pieces of the literature of very smart people who are writing about systems thinking within public health practice, and kind of help to organize a landscape of systems dialogue to help practitioners really get to the nuts and bolts of what may be important to pay attention to within a system. Next slide. So what I'm going to just reference very quickly is some of the tools. Now, while we have the model of this kind of 4-component consideration, the tools themselves are wide and varied. There are several volumes that have been published recently to try to integrate a number of systems science tools that can be helpful. But it still feels at many times like somewhat confusing and hard to navigate landscape. So I just wanted to show you very quickly some of the ways that we can use these tools to help us think about work within one or all of these domains. So I present to you, this is Stafford Beer's viable systems model, and it's really just a tool to help us understand how systems organize and how systems function. And actually, this is a model that's built upon the premise that any organization, biological, personal, or population system, operates in the same manner. So if you think about your own human body as a system, to be viable, there are certain functions that each level of your biological system need to kind of think about, whether that's the policy level, i.e. Your brain telling your body how to functionally manage. If you decide that you're going to walk down the street, a lot of different parts of your biological system need to function in a way that is coordinated and works in concert to move your body down the street. At the same time, your body is taking in feedback and information from outside of it to process and to better understand kind of how to integrate and utilize those functions to actually move your body. That example at the biological level can be extrapolated to the organizational level to think about how you have different functions at different levels. We've used this in the past to really identify where there may be problems. For example, one of the things we found in one of our studies is that we had parts of the system that were down in the operational level, the making things happen level, that were actually setting policy at the determining system policy at the number 5 level, up there at the policy level. And that problem with the operational level setting policy became a functional problem for the system, and the model helped us organize and better align functions according to how the system needed to operate. Next slide. In terms of understanding networks, there are some newer analytical models that can be used, like network analysis, to really understand changes in network structure, because relationships are key in a system. And so our efforts to really focus on how networks can come together and resolve how communications and information move through these networks. We've used network analysis as a tool in the past to really understand who's connected to whom, how does information move from one person to the other, who are the key information hubs or brokers of information, and can we organize changes to shift networks in a way that allows for optimal functioning. And to be able to answer those kinds of questions, we need tools like network analysis to be able to identify and understand what the network looks like, and then how might tweaks be made to that network to improve communication, information movement, and activity. And so we've used network analysis in the past in a sequenced way to understand kind of a pre and a post. Looking at this in a pre and a post world to understand what changes were able to be incorporated. Next slide. And finally, when we think about models, often we have very different perspectives about what the cause of a problem is, as well as what the solution may be. And often we will utilize a tool called group model building to help us organize this conceptualization, this conceptual model or theory of change about the way the problem exists and the solution to that problem. And often what we discover is that it's much more complex perspectively than any document or any manual or any set of written guidance ever communicates to participants or developers. So, often we're limited in terms of our understanding as things are drawn up and written out in terms of interventions. It's really when we sit down with groups to engage them in a collaborative process of actually sketching out and building the model of change that we discover in a very nonlinear way how complicated and complex the intervention is. Beyond just simply the intervention, it's also the implementation of that intervention as well as the sustainability of that intervention. Okay, so next slide. I think that's it. Sorry it took too much time. There's not a lot of time for questions, but I do appreciate the opportunity to talk a little bit about systems thinking and complexity.
Great. Thank you, Scott, and thank you, Lauren. I wanted to just invite people to ask a question or make a comment, and maybe I'll start that process by, first of all, linking the two. And I think Lauren's offered a really ground level view with the same ideas as Scott has presented, a kind of a higher level view, but they're talking the same language. And I think the challenge for us is to help people learn how those ideas, and they're very parallel, although it's a ground level versus a high level view of how we can use those lenses or ideas in different ways. And I'm starting maybe with a question around how the teachers in Lauren's example, if it was useful to them, they kept on going. And yet we don't really take a deep dive into what teachers' workloads, teachers' concerns, teachers' beliefs, and so on are relative to the issue at hand, or even in terms of their workplace. And so that's kind of thinking that Lauren mentioned the idea of when here's a practical example: when a school principal or a head teacher changes, he or she brings in a different agenda to the school, and that has a big impact on the school. Even though it's a complex and stable organization with lots of chaos, it changes the direction of the school or the focus of the school when a new CEO comes in. That happens in any organization. And yet we've talked about the role of the school principal in school health as being important, getting things started, but we haven't talked about what happens when that principal changes over. And that kind of, and another kind of broader view, same idea though, is Scott talked about the concern about educational outcomes being a systems concern obviously for educators, and being able to put that back down into practical levels, particularly around health and managing the expectations. I'm always struck by a comment that a colleague made about schools are not expected to be responsible for reading behaviors well into adult life. They're expected to graduate students who can read and write in a reasonable way. And so we need to be careful as we manage expectations about health outputs versus health outcomes. What is it that we can expect schools and the school environment to do in terms of health and social development of kids at that age level? Are they equipped for future choices, but not to be accountable for those future choices? So those are kind of a couple of comments, but we've got a couple of questions, and I'm going to go to them and ask Lauren and Scott to answer them. Aaron has asked, how do you think we could better use systems thinking in schools? Lauren works with the National Association of School Nurses, and we have the whole school model that has been developed there. But we don't really have good research or even really strong implementation of the model. And so how can we move forward if we don't have that kind of linkages to systems change? Scott or Lauren, do you want to comment on that?
That's a big question. I guess maybe I'm indirectly gonna cover it. I think as I was thinking about actually the indicators themselves. This is the document that you're going to move on to, and then looking at that, and And in a way, the indicators or the document is an intervention, and it's a great place to start about thinking about systems thinking. The first thought I had was that, these indicators are difficult for me to understand and read, and I'm someone that's in this subject area. So I was thinking, what some of the questions that came to mind is what indicators do countries currently use? What data do they currently use? What is the context that they're working in? How are these indicators going to be communicated to them? I mean, are they communicated in a way that's going to make it as easy as possible for ministers to understand them? What training is there going to be to help them use the guidelines? It's these sorts of questions to understand the context that people are working in, and to try and meet them at that level and think about, well, how could we try out different things to help them to implement or sustain things, and then evaluate whether those kind of processes or approaches have been successful. And I think there isn't lots of research out there that's telling us what approaches are effective. This is a new area for all of us, and I think it is an area that we do need to evaluate and kind of move forward in steps. And I think in a way the indicator document itself is just a good example of how difficult it is to start thinking in a different way about moving things from infused individuals to changing wider systems.
Thank you, Lauren. Scott, do you want to respond to Aaron's comment or question?
Yeah, sure. I think the one, often when I begin engaging a new group around systems thinking, we spend a lot of time really trying to unpack some assumptions about what it is that we're interested in looking at. And we ask the hard questions up front about whether or not there's an expectation that an intervention or something that's being instituted within a system is actually intended to lead to systems change. And often what we'll find is that in some cases people don't actually believe that a health promotion curriculum or program is in fact intended to lead to systems change. And so it kind of establishing some broader understanding among the principals that what it is that we're doing is in fact trying to lead to systems change, that it incorporates some of these aspects of complicated environments and complex environments, is really needed up front and agreed upon with the principals and I say principals, I'm talking about stakeholders, the broad base of stakeholders that are engaged in this, because it does require kind of a shift in thinking and perspective to be able to understand the nature of how systems coalesce and lead to change. From a more practical standpoint, I think it's really important to use kind of systems thinking and understanding to explain why certain things are the way they are. For example, Lauren mentioned earlier this challenge with adaptation. We've done some work where we've looked at this dynamic of planned adaptation versus natural adaptation of models and curriculum. And what often happens around that is that it becomes very contested about the degree to which implementers have to follow a prescribed set of expectations around implementation of something, and the question of whether we plan for adaptation versus just letting adaptation happen, or pressing back to a situation where there's no adaptation allowed. Those are all, if you view that from a systems lens, that becomes a systems issue rather than kind of well, this teacher decided to do it differently and that teacher decided to do it differently and this school system is doing it differently than the other school system. It allows us to kind of move away from the finger pointing that often happens when we think about change and implementation of interventions to viewing more of the system dynamic and why that's the case, and how that then leads to other things or other effects within the system.
Thank you, Scott. I'm looking at Anna Marie's question, and we are a little bit pressed for time, but Anna Marie, I'd like to say that if the fact that your government organization is beginning to think about this kind of thing is, in my view, is the step forward. It's using the systems thinking lens, or using the kind of analysis that Lauren talked about. So once people get that idea and say, yes, we need to do more of this, we can start to make progress. And so the fact that you are working at the government level to try to implement some of these systems, the long word I use, systems focused continuous improvement approach, it's very bulky, but it does kind of change our orientation about implementing programs, and I think that's very important. Other questions or comments? And I'm going to just briefly move to the document itself and invite you to go back to fresh-partners.org to comment on it. These are the cross-country themes, cross-cutting themes that we have identified. They're in the document. We don't need to spend time on them, but I do want to make one point about because systems, particularly as you go up in the system, in the school system or the health system, it's a system built around documents. And as Scott said, there's no document that can capture the kind of complexity that exists at every level: school, district, agency, or ministry, or in between. But if we can start to look to things that start to work towards some standardized or method for dealing with it, and the example of situation analysis, a very, very important, challenging task for systems for the process. But there is now a number of documents. So UN agencies and many others are starting to produce documents that say, here's a tool that works in our system, in our context, for doing a proper situation analysis. So not only the use of the document, but again, and the latter side of the table there, the fact that you'll make progress in using those kinds of documents effectively. So that's an example of a complex process within systems change that people are starting to develop standardized tools and so on. And here's one without one, the idea of developing a shared vision across the systems, as Scott has mentioned, the contested versions of it. And so there isn't an easy way, a handy-dandy tool that starts to simplify that for us. And it isn't simple, but it helps us to gather our thoughts. But there is another one. Here's about, no, I'm going to skip through that. I'm going to go to this one here, where there is a complex challenge or assessment of trying to plan for implementation. And there are some tools out there in the red font, the REAIM framework, the concerns-based adoption model. We do that kind of implementation process usually, well, no, not usually, less so now, but it used to be by our own experience, about our own practical experience. But there are now frameworks to help us guide through that in terms of health promotion and school health promotion. And so again, and Lauren pointed out that the REAIM framework is really about implementation. It's not so much about maintenance and scale up and sustainability, but there are tools that are starting to emerge that help us put our thinking and action into a language that we can all share together. And so that's the kind of movement I'm hoping that we're going to see over the next several years. And this particular document is, Lauren, you're right, it's kind of an intervention itself. It's trying to move the discussion along. Scott and Lauren, you can maybe comment on this about what's your assessment about how school systems and health systems are starting to think about systems more and sustainability more and these kinds of ideas more. Are we making progress that way? And this particular fresh attempt is to try to identify things that UN agencies and others are doing and then move the agenda forward. And there are many more questions or many more items in this document than there are concrete or practical or strategic ways of dealing with it. So maybe Lauren and Scott, maybe to ask about how do we make progress through these kinds of materials, and what you think would be the next best step for us to think about?
I'll have to head off soon, but I'm happy to answer this question. I guess I had a look at the conceptual frameworks, as I mentioned to Doug the other day, and for my thesis, and I didn't find any of the ones that were on sustainability very practically useful, and I think that it is really an area for development. I think we're a bit in academia a bit sniffy about looking to kind of the organizational change or the business literature. You know, how do people scale up their businesses? How do they communicate with their customers? You know, what are they doing to make themselves into a franchise that can be easily adopted? You know, we probably have a lot to learn from those from that sort of literature than the academic literature about how do we make it easy for things that we believe are effective, scientifically effective, to be taken up by schools. I just think we're not so far super good at it, it is an area that really needs to be developed more. I think it's good to start using these tools, but as I said, yeah, some of them, yeah, aren't massively helpful on a practical level for someone that's trying to adopt them. It's good because they're showing, I guess, using the frameworks indicates that they're interested in trying to use something that's more principled or theoretical. That's my answer, I guess.
Thanks. Scott, do you want to comment?
Yeah, I think I agree with Lauren. I mean, there are challenges that abound in all of this, and I think moving towards a systems thinking perspective, not only do we have to develop some of these indicators that align with those kinds of perspectives, like a systems thinking view, but we have to have tools that are practical and can be utilized. I presented some of the systems tools that I've used in the past to help guide some of that work along, and those too are not very user-friendly. They require a certain level of expertise. They can often be quite complicated in their own right, and so for everyday use, I just don't think that they're anywhere close to being available or accessible to the work that's being done on the ground.
It made me think. I mean, this is in the beginning actually, like my interest in the subject is is all about the practical kind of usefulness of research. You know, how do we make it useful for people? We did a lot of I was involved in the evaluation of the Work Centre for Crime Reduction. I sat there as someone that used to be a youth offending officer a long time ago, looking at this list of interventions that were kind of rated on their kind of quality and evidence base. And I was thinking that this isn't how it works for the practitioner. The practitioner has a problem in front of them that they need to address, but this is a list of interventions for different problems. Like, this is a complete mismatch to what someone would need. And in England, we have developed knowledge bases around reducing the attainment gap between poorer students and wealthier students. And there is some research that's about kind of how useful those tools are for teachers, but it's an early stage of development, and there needs to be a lot more involvement of school staff in like kind of the development of these sorts of tools to make sure that they are going to be used in real life.
Yeah, agreed. I agree with you completely. In fact, when I first submitted my paper to be published on systems thinking and complexity, the reviewers pressed pretty hard on the idea that I needed to make this more practical. Like they essentially had embraced the the argument that I was making about systems, incorporating systems thinking and complexity into health promotion for schools, but there needed to be something more practical available to readers. And so in that, I went back and really thought about what are the specific systems thinking questions that one could present at the different school health promotion stages of development, improvement, and sustainability. And so there's a table in there that in that paper that really looks to try to make much more practical, even from the question standpoint, what questions could be asked at these different stages across these different domains. Now, that only kind of presents the kinds of questions that might be asked from a systems point of view. It doesn't really align or bring somebody to, okay, then what tools can we use to actually ask those questions? Because that just is such a long and scattered inventory that it's very difficult for individuals to navigate. The good news is that, much like what Lauren said, there isn't somebody who comes in from the outside and says, I've done an analysis of your system and here are the results. Real systems thinking and complexity work involves individuals. It involves collaboration and dialogue and interaction with leaders, with officials, with those that are implementing the processes. And in some cases, it involves it can involve targets of the intervention in all of this systems work. So if we subscribe to kind of a systems viewpoint, it means that everybody's view in that system is equally important.
Thank you, Scott. I see that Lauren is really pressed with her next event in her schedule, but we'll start to close up. And thank you, Lauren, for participating, and do want to engage you and others. And I'm seeing Margaret Miller. If that's you from Australia, it's very late in the evening for you. So thank you for being here. But maybe just to go to one final. I think it's really there. Yeah, this is the. I've been challenged when I bring this kind of conversation to middle managers and upper, higher level managers. They want to keep it simple even though they know it's all complex. And so we need to identify the kinds of outputs that they would understand. But it's getting them to think in a different way, but also giving them some concrete examples. The most important thing is they make a shift in their thinking. And it's, as Scott's one of your slides said, it's all about process and not product. And so these are products, but they're constructed by a number of processes. And so these are kinds of things with relatively simple things to understand. You have a job description for your coordinators. Well, first of all, getting coordinators is very challenging, and then having a job description that people can within the hierarchy that they're working within is also a challenge if you've ever tried to hire a new staff person with a new role. And so it's a simple output of having a job description, but it's very complex in its development and delivery. So we need to be able to translate these systems related thoughts to kind of concrete things that people go, oh yeah, we have a job description, or we have an interministry agreement, and then and then looking deeply into those agreements is another matter. That's where the complexity comes in. So those are kinds of things I'm hoping that over the next few years we're going to be able to see more and more of, and hopefully the document that is on the page that was indicated earlier, you can find it on the fresh-partners.org website, is something that we can, there we go right there, we can take part in terms of the next steps. And so I'm going to ask anybody for any, Peggy or Margaret or Aaron, any further final comments before we close up, or Scott, and I'm not sure if Lauren has had to physically leave or not, but any final thoughts before we close up? So if not, I'm going to just stop the recording.